Have you ever wondered why orthopedic assessment is crucial in patient care? Well, it's a lot more than just a routine checkup. This comprehensive evaluation plays a pivotal role in diagnosing and treating a vast array of musculoskeletal conditions. From a minor sprain to a complex spinal disorder, orthopedic assessment is the first step in the journey towards recovery. By examining the body's musculoskeletal system, healthcare providers can detect abnormalities that might otherwise go unnoticed. An early diagnosis can prevent complications down the line, helping patients avoid unnecessary discomfort and distress. But the benefits don't stop there. An effective orthopedic assessment can also guide treatment decisions, ensuring each patient receives the most appropriate and effective care. This, in turn, can significantly improve patient outcomes, enhancing their quality of life and overall well-being. Orthopedic assessment isn't just a procedure, it's a proactive approach to healthcare. So, a comprehensive orthopedic assessment is a cornerstone in the management of musculoskeletal conditions. The first step in orthopedic assessment is taking a health history. Yes, that's right. It's a crucial initial step that sets the stage for everything else that follows. But why is it so important? Well, it's because health history gives us context. It paints a picture of the patient's overall health status, helping us identify potential risk factors and guide our subsequent assessments and decisions. So what does a comprehensive health history entail, you ask? Well, let's break it down. Starting with the past medical history, we probe into any previous illnesses, surgeries, or hospitalizations. It's like reading a book about the patient's health journey, each chapter contributing valuable insights. For example, a patient with a history of rheumatoid arthritis might have joint issues that could influence their orthopedic status. Next up is the family history. It's all about genetics here. Certain conditions, like osteoporosis or some types of arthritis, have a genetic component. Knowing the patient's family history helps us understand their potential predispositions and plan accordingly. Now, let's talk about lifestyle. It's a broad category, encompassing everything from the patient's occupation and physical activities to their dietary habits and smoking or alcohol use. Why does this matter? Well, an office worker who sits at a desk all day might have a different orthopedic profile than a construction worker, for example. Lifestyle gives us clues about potential stresses on the musculoskeletal system. Finally, we have the symptoms. This is where the patient's current complaints come into play. Pain, stiffness, swelling, difficulty moving. These are all vital pieces of information that guide us towards a potential diagnosis. So there you have it. Past medical history, family history, lifestyle, and symptoms. These are the key components of a health history. Each piece contributes to the puzzle that is the patient's overall health status. Remember, the health history provides a foundation for the rest of the orthopedic assessment. By understanding the patient's unique health story, we can move forward with a clear direction, ensuring a thorough and targeted orthopedic assessment. After taking a health history, the next step is a physical assessment. The physical assessment is a vital part of the patient evaluation process, and it consists of 4 key components: inspection, palpation, percussion, and auscultation. Each contributes uniquely to the overall understanding of a patient's orthopedic health. Let's start with inspection. This is the most straightforward part of the physical assessment, but don't let that fool you into thinking it's any less important. During the inspection, we're looking at the patient's general appearance and noting any visible abnormalities. This could include physical deformities, swelling, changes in skin color, or abnormal movements. The inspection gives us our first clues about what might be going on beneath the surface. Next is palpation, which is the act of feeling with your hands. This is a hands-on approach, literally. We're feeling for any abnormalities that might not be visible to the naked eye, such as temperature changes, lumps or bumps, tenderness or pain. Palpation can help us pinpoint areas of concern that need further investigation. Moving on to percussion. This is where we tap on the patient's body, like a drummer on a drum, and listen to the sound it makes. Different tissues produce different sounds. For instance, a lung filled with air will sound different than a lung filled with fluid. In the context of orthopedic assessment, percussion can help us identify areas of bone density changes or abnormalities. Lastly, we have auscultation, which involves listening to the body's internal sounds using a stethoscope. Now you might be thinking, wait a minute, I thought auscultation was just for the heart and lungs. Well, it's true that it's most commonly used for those, but in orthopedics, we can also use auscultation to listen for sounds in the joints, like crepitus, which is a crackling sound that can indicate joint inflammation or damage. Each of these components, inspection, palpation, percussion, and auscultation, contribute to the overall understanding of a patient's orthopedic health. They all provide different pieces of the puzzle, and when put together, they can help us form a comprehensive picture of what's going on. Remember, the physical assessment is not just about identifying problems, it's also about assessing a patient's baseline status, which can be incredibly valuable when tracking progress or changes over time. So even if a patient appears to be in good health, don't skip the physical assessment. It's an essential tool in our toolkit as healthcare practitioners. A well-conducted physical assessment can provide valuable insights into a patient's orthopedic health. Next, we move on to the neurovascular assessment. The neurovascular assessment is a crucial part of orthopedic patient evaluation. It's a key tool in detecting nerve and vascular injuries, which can have serious implications if left unrecognized. The assessment helps in identifying early signs of compromised blood flow or nerve function, allowing healthcare professionals to intervene promptly and prevent further complications. Now let's delve into the 5 P's of neurovascular assessment. These are pain, pallor, pulse, paralysis, and paresthesia. First, pain. This is usually the earliest sign of a neurovascular injury. It's important to ask patients about the presence of any pain and its characteristics. Is it sharp or dull? Is it constant or intermittent? These details can provide vital clues about potential nerve or vascular damage. Next, pallor. This refers to an unusual paleness in the skin. Pallor can be an indication of reduced blood flow to the area, which could be due to a vascular injury. Third, we have pulse. Checking the pulse in the affected area can help determine the adequacy of blood circulation. Absent or weak pulses might suggest vascular compromise. Then, paralysis. This refers to the loss of muscle function. If a patient is unable to move a certain part of their body, it could indicate a nerve injury. Finally, paresthesia. This is an abnormal sensation like tingling or numbness, often described as pins and needles. Paresthesia can be a sign of nerve damage. Each of these 5 P's provides a piece of the puzzle in neurovascular assessment. They help paint a clearer picture of the patient's neurological and vascular health, guiding the next steps in management. Remember, these assessments are not standalone tests. They are part of a comprehensive orthopedic evaluation, and the results should be interpreted in the context of the patient's overall health and clinical presentation. A thorough neurovascular assessment helps in the early detection of potentially serious complications. Another key component of orthopedic assessment is the examination of reflexes. Now you might be wondering, why reflexes? Well, reflexes are our body's automatic responses to specific stimuli, and they play an essential role in our daily lives, protecting us from danger and helping us interact with the world around us. But in a medical context, reflexes are even more crucial. Testing them can help reveal a lot about the health of our nervous system. They can provide vital insights into the functioning of our peripheral and central nervous systems. In fact, abnormalities in reflex responses can be indicative of nerve or muscle disorders, such as neuropathy, myopathy, or spinal cord injury. So, how do we go about testing reflexes? Most commonly, we use a neurological hammer. You've probably had this done during a routine checkup. The doctor taps certain areas of your body and your muscles respond with a small, involuntary jerk. This is your reflex action kicking in. There are several reflexes that can be tested, each associated with different nerves. For instance, the biceps reflex tests the C5 and C6 nerve roots, whereas the triceps reflex evaluates the C7 nerve root. The patellar, or knee-jerk reflex, tests the L2 to L4 nerve roots, and the Achilles reflex tests the S1 nerve root. Interpreting the results of these tests requires expertise, as reflex responses can vary from person to person. Generally, a brisk or exaggerated reflex response may suggest a possible upper motor neuron lesion, while a decreased or absent reflex could hint at a lower motor neuron lesion. However, it's not just about the presence or absence of a reflex. The speed and force of the reflex, the symmetry of responses on both sides of the body, and any associated movements or sensations all contribute to a comprehensive understanding of the patient's neurological health. So you see, the humble reflex test is a powerful tool in the hands of a skilled clinician. It's a simple, non-invasive procedure, yet it can reveal a wealth of information about the body's complex nervous system. Examining reflexes can provide valuable clues about the functioning of the nervous system. Finally, we come to the assessment of range of motion. Now, what does range of motion mean? It refers to the full movement potential of a joint, usually its range of flexion and extension. For example, how far you can bend your elbow, or how high you can lift your arm. Why is it important, you ask? Well, assessing the range of motion is vital in determining the function of a joint. It lets us know how far a joint can move in any direction without causing pain or discomfort. It's a critical part of the orthopedic assessment, as it helps in diagnosing arthritis, tendinitis, and even nerve damage. The process of measuring the range of motion is quite straightforward. We use a tool called a goniometer, which is a bit like a protractor. It measures the angle at which a joint can be bent or straightened. The goniometer is placed at the joint. One arm follows the line of the body part that's stable, while the other follows the part that's moving. It's a simple yet effective method of quantifying joint mobility. Interpreting the results, however, requires a bit more finesse. You see, each joint has a standard range of motion that's considered normal. Any deviation from this norm can indicate a problem. For instance, a reduced range of motion could suggest stiffness or damage within the joint, while an increased range could suggest joint instability. It's all about understanding the nuances and making an informed evaluation. But remember, range of motion isn't just about numbers. It's about how these numbers translate into a person's ability to perform daily activities. Can they reach the top shelf? Can they tie their shoes? Can they comfortably do the things that matter to them? That's the real value of assessing range of motion. So, by looking at the range of motion, we get a clear picture of a patient's joint mobility and function. It's an essential piece of the puzzle, enabling us to provide the best possible care. Assessing range of motion gives us a clear picture of a patient's joint mobility and function. So, we've walked through the steps of an orthopedic assessment, but why is it so important to be thorough? Let's take a quick step back and remind ourselves of what we've discussed so far. We began with the health history, which is much more than a simple checklist. It's a comprehensive review of a patient's past and present health conditions, lifestyle habits, and even their emotional state. This information is invaluable. After all, understanding where the patient is coming from helps us determine where we need to go in terms of diagnosis and treatment. Moving along, we delved into the physical assessment. This is where our observational skills truly come into play. We're looking for any visible abnormalities in the patient's musculoskeletal system, like swelling, deformities, or changes in skin color. But we're also relying on our other senses. Can we feel any unusual lumps or bumps? Is there a difference in temperature when we touch the patient's skin? The physical assessment is a multisensory exploration that provides essential clues about the patient's orthopedic health. Next, we tackled the neurovascular assessment, which is all about assessing the nerves and blood vessels. We're checking for sensation, motor function, and blood flow. Any abnormalities here could indicate a potential neurological or vascular issue, which could have serious implications for the patient's mobility and overall well-being. Then we moved on to reflexes, an often overlooked but critical aspect of the orthopedic assessment. Testing a patient's reflexes can reveal a lot about their nervous system health. It's like a sneak peek into how their body responds to stimuli. Diminished or hyperactive reflexes can be a sign of various neurological conditions, so it's crucial not to skip this step. And finally, we covered the range of motion. This involves assessing joint mobility and muscle strength. If a patient's range of motion is limited, it can significantly impact their daily activities and quality of life. Plus, it can be a sign of underlying orthopedic issues that need to be addressed. So, why is it so important to be thorough in our orthopedic assessment? Because each of these steps, from health history to range of motion, provides a unique piece of the puzzle. They help us form a complete picture of the patient's orthopedic health. Skipping any step or rushing through the assessment could mean missing out on crucial information, which could lead to misdiagnosis or ineffective treatment. But it's not just about the technical aspects. A thorough orthopedic assessment also shows our patients that we care, that we're not just there to treat their symptoms, but to understand their health in a holistic way and help them improve their quality of life. Remember, a thorough orthopedic assessment is essential for achieving the best patient outcomes. It's not just about checking boxes, but about understanding the patient's health in a holistic way.